Hello everyone. Welcome back. And today our topic is going to be gastric lavage, right? So gastric lavage, basically we are going to discuss it in very simple words. So how I understand gastric lavage is, for example, a person has ingested a poison, एउटा मान्छे छ, he has ingested a poison through oral route. Through oral route, he has ingested a poison. Now the poison is in his stomach, right? Now the poison is in his stomach. अब तिमीले मलाई भन्नु पर्यो यो पोइजन जुन स्टोमकमा छ नि यो कति घण्टासम्म it remains in the stomach. So it is going to remain in the stomach for 1 to 2 hours, right? As you know that stomach is a temporary reservoir of food, and for 1 to 2 hours the poison is going to remain in the stomach. Afterwards, it is going to go into the intestine. And after it goes into the intestine, it is very harmful because intestine is the place where absorption occurs. होइन सो एब्जर्प्सन भएपछि त पोइजनले अब एउटा सिग्निफिकेन्ट एडभर्स इफेक्ट देखाउन थाल्छ. द्याट इज वाइ इट इज भेरी इम्पोर्टेन्ट द्याट वी एक्ट भेरी फास्ट, वी एक्ट भेरी ऱ्यापिडली when the poison is still in the stomach. By any means, if we are able to wash out this, if we are able to wash out this poison, it is going to be of significant benefit. And this is exactly what gastric lavage is trying to explore. So remember that in case of ingested poison, when the poison is in the stomach, if it has only become 1 to 2 hours after the poison has been intaken, we are going to wash this poison by help of water or by help of certain solution. Then that process is known as gastric lavage. So how exactly do we perform this? We are going to put a tube. होइन एउटा ट्युब राख्नु पर्यो यहाँ, अनि यो ट्युब चाहिँ यहाँ स्टमकसम्म कनेक्ट गर्नु पर्यो. त्यसपछि यहाँबाट के गर्नु पर्यो, वाटर इन्सर्ट गर्नु पर्यो, र दिस वाटर इज गोइङ टु नाउ इट इज गोइङ टु वाश आउट दिस पोइजन. So this is the first thing. Right? So one and only aim of gastric lavage is washing the stomach before the poison reaches into the intestine. Number one. Number two. अब यो washing भनेको कस्तो हो, डाइल्युट गर्ने खालको हो कि के हो त भन्दाखेरि, रिमेम्बर द्याट how I remember gastric lavage is like washing your clothes. So how do you wash your clothes? एउटा बकेटमा if you have dirty clothes, you are going to put clean water, होइन clean water राख्छौ, then you are going to wash it, and then again you are going to evacuate this water. You are going to remove this water. हो किन यो पानी फाल्नु पर्यो नि त. त्यसपछि फेरि के गर्ने, फेरि क्लीन वाटर राख्ने, वाश गर्ने, अनि वाश गरेपछि फेरि के गर्ने, फेरि यो पानीलाई फाल्ने, फेरि क्लीन वाटर राख्ने, फेरि वाश गर्ने. यो कहिलेसम्म गर्ने? We do this until the cloth become very clean. So similarly, gastric lavage also works on the same principle. In this process, what we are going to do, we are going to put water into the stomach. We are going to wash the poison. Then we are again going to extract this. है हामीले यसलाई फेरि के गर्ने, एस्पिरेट आउट गर्ने. अब एकचोटिमा त यो पोइजन सफा हुँदैन. सो अगेन हामीले क्लीन वाटर राख्ने, फेरि वाश हुन्छ, फेरि यसलाई रिमुभ गर्ने, फेरि पानी राख्ने, फेरि वाश गर्ने, फेरि रिमुभ गर्ने. दिस प्रोसेस इज this is the method of gastric lavage. So this is exactly what we do it. Right? So now let's go on to the introduction. It is the process of removal of ingested poison. So if the poison is ingested, then we are going to use this. We cannot use this in case of inhaled poison. जस्तो कसैले H2S gas smell गरेको छ भने the poison is in the lungs. There is no purpose of gastric lavage. So that is why this line becomes very important, that it's used for the removal of ingested poison, and is the most common method of decontamination of oral poisons. What is the time? The time is less than 1 hour after ingestion of poison. This is most effective. So 1 hour भन्दा कम गर्यो भने त एकदम इफेक्टिभ भइहाल्छ, किनभने at that time it may not have gone into the intestine, but you can do it up to 2 to 3 hours. So we can use various tube, as I told you that we are going to insert a tube right into the stomach. So what tube can you use? So lavacuator is the most commonly, it is the most ideal tube that is used. However, generally we use Ewald's tube and Boas tube. Generally in adults we use Ewald's tube र Boas tube, and children मा चाहिँ हामीले के use गर्छौं, Ryle's tube use गर्छ. Right, this can be asked in spotters as well. Ewald's tube हरू, Ryle's tube, it can be given in spotters. Now एकदमै इम्पोर्टेन्ट कुरा के छ भन्दाखेरि कुन पोजिसनमा गर्ने त gastric lavage. Remember that gastric lavage is done in this position, and this position is known as left lateral position. This is known as left lateral position. Now I'll explain you why it is done in left lateral position. Tell me what was the main aim of gastric lavage. The main aim of gastric lavage was to wash away the poison before it has reached the intestine. So इन्टेस्टाइनमा चाहिँ हामीलाई जान दिनु भएन के त्यो पोइजनलाई है, जति पनि हामीले यो गर्दैछौँ इभ्याकुएसन, यो जति पनि यो फ्लुइड छ यो चाहिँ इन्टेस्टाइनमा जानु भएन. सो इन्टेस्टाइनमा जान नदिनको लागि के हुन्छ भन्दाखेरि whenever a person is lying in left lateral position, as you can see the pylorus is facing upward. You can see this is the pylorus. The pylorus is facing upward. So if the pylorus is facing upward, that means that this is the small intestine, this is the duodenum. So the small intestine and duodenum are also facing upward. So if this is facing upward, then this fluid, it becomes very difficult to go into the small intestine. And another thing is that it has to be done in Trendelenburg position. So this Trendelenburg position, एउटा position चाहिँ यो हो, एउटा चाहिँ left lateral position. So what is this Trendelenburg position? If you look at this drawing carefully, you'll see that the person is sleeping in an inclined position. This inclined position is known as Trendelenburg position. Why this position is very important है? के हुन्छ भन्दाखेरि ग्यास्ट्रिक लवाजमा हामीले जब स्टोमकमा ट्युब राख्छौँ नि, स्टोमकमा ट्युब राख्दाखेरि त्यहाँ रिगर्जिटेसनको एकदमै धेरै रिस्क हुन्छ क्या, रिगर्जिटेसनको धेरै रिस्क हुन्छ. सो इभन इफ रिगर्जिटेसन भयो है, रिगर्जिटेसन भयो भने पनि इफ वी आर मेकिङ अ पर्सन स्लिपिङ इन दिस पोजिसन, द एक्सपल्ड कन्टेन्ट जति पनि त्यो भोमिटसहरू छ यदि रिगर्जिटेट भयो भने चाहिँ इट इज गोइङ टु कम आउट अफ द माउथ. सो इफ यु आर मेकिङ अ पर्सन इन दिस पोजिसन, के हुन्छ भन्दाखेरि यहाँ इसोफेगसबाट कन्टेन्ट, यो स्टोमकबाट कन्टेन्ट बाहिर आइराखेको छ, देन यहाँ माउथ छ, माउथसम्म पुग्नलाई धेरै गाह्रो हुन्छ, एन्ड द कन्टेन्ट मे पुल नियर द ल्यारिङ्स एन्ड इट मे गेट इन्टु द lungs के लङ्समा जाने धेरै रिस्क हुन्छ. द्याट इज इफ यु पुट अ पर्सन इन दिस पोजिसन, ग्राभिटी इज गोइङ टु फेसिलिटेट the regurgitated contents from the mouth. So that is going to prevent aspiration. That is why these two positions are very, very important. Now I'm going to tell you what are the steps of gastric lavage. Okay. Before we go on to the procedure, I like to tell you what solutions can we use in gastric lavage. So as you know that I told you water, generally water is the most commonly used. हामीले यसरी ट्युब भित्र राखिसकेपछि यहाँबाट के सल्युसन दिने त? Generally हामीले वाटर नै युज गर्छौँ because water is very good for washing. However, depending on the poison, we can use other solutions as well. That basically is for the purpose of neutralization. जस्तो यदि iron poisoning छ भने we can use desferrioxime. As you know that आइरनलाई न्युट्रलाइज गर्ने यसले हो. Oxalateलाई calcium gluconate can be used. Similarly, for carbolic acid, we can use castor oil. Cyanide like sodium thiosulfide. Potassium permanganate is used for alkaloids, the poisons that are alkaloid in nature. And generally, lukewarm water or saline. This is used. This is the most common fluid used. The most common fluid is generally lukewarm water or saline. You can remember the table as well. यो तलको प्रोसेस, यो तलको फ्लुइड चाहिँ जनरली यसको पर्पस चाहिँ न्युट्रलाइजेसनको लागि हो. जनरली नाउडेज ग्यास्ट्रिक लवाज इज लेस अबाउट न्युट्रलाइजेसन एन्ड मोर अबाउट इरिगेसन के. सो जनरली अहिले हामीले ग्यास्ट्रिक लवाज चाहिँ न्युट्रलाइजेसन भन्दा पनि त्यो वासिङ अवे गर्नको लागि युज गर्छौँ. द्याट इज वाइज नाउडेज मोस्टली वी युज लुकवार्म वाटर अर सलाइन regardless of any poison. Now, what is the procedure? I like to show you a video, then I think you'll understand it more better.
So in this process we insert a tube. This tube is known as Ryle's tube. We can enter it, we can insert it through the nose or through the mouth. So as you can see, the tube is being inserted down. Now there is the tube. When it is inserted, as you know, there is a common pathway between the lungs and the esophagus. Sometimes the tube may go into the lungs as well. So for confirmation that it has reached the stomach, we are going to put a stethoscope in the stomach, and through the syringe we are going to insert air. So that is the air. So if when air is inserted into the stomach, as the stomach is full of fluid, so that is going to create a bubbling sound which is heard in the stethoscope. So that confirms that it has reached. Now we are aspirating the content from the stomach. Okay, we are aspirating it. Now as you know, now it's time for washing. So we are going to put normal saline or water. We are inserting normal saline or water into the stomach. This is going to help in washing of the contents. So as you can see, the water is going very fast. Now we are trying to aspirate it. So we are aspirating the content of the stomach. As I told you, gastric lavage is all about insertion of fluid and aspiration of fluid. We are inserting clean water, we are washing, we are removing it. So we are removing this water. As you can see, we are removing the water out. Till when are you going to do this? You are going to do this till clear fluid comes out.
So let us come into the theory part. The patient is put in Trendelenburg position and left lateral decubitus position. A tube is second step is introduction of the tube. The tube is lubricated and inserted from nose or mouth. The tube is pushed down till the mark. So there is actually a mark है यो जुन इवार्ड्स ट्युब हुन्छ नि इवार्ड्स ट्युबको टोटल लेन्थ भनेको इट इज 150 सेन्टिमिटर विथ मार्क at 50 centimeter. So एउटा यस्तो खालको ट्युब हुन्छ that has a funnel as well, that has a suction and यस्तो खालको ट्युब हुन्छ सो यो पार्ट चाहिँ इन्सर्ट गर्ने र यहाँ एउटा मार्किङ हुन्छ के सो यहाँ के हुन्छ त भन्दाखेरि एउटा मार्किङ हुन्छ सो जबसम्म यो यति चाहिँ 50 सेन्टिमिटरको हुन्छ र यो बाँकी चाहिँ 100 सेन्टिमिटरको हुन्छ सो टोटल लेन्थ कति भयो 150 सेन्टिमिटर सो वी आर गोइङ टु इन्सर्ट दिस अप टु दिस मार्किङ है अब यो मार्किङसम्म चाहिँ इन्सर्ट गर्ने हो के so the tube is lubricated and inserted. The tube is pushed down further till the mark 50 centimeter coincide with the upper incisor teeth. So जबसम्म 50 सेन्टिमिटरको मार्क चाहिँ माउथमा आउँदैन होइन इन्सिजर टिथसम्म आउँदैन then we are going to insert. Now how to confirm the tube has reached in the stomach? As you might have seen the video, we are going to put a stethoscope in the stomach and a little air is forced into the tube through the syringe. So syringeबाट चाहिँ के हुन्छ अलिकति एयर चाहिँ इन्सर्ट गरिदिने and due to which if bubbling sound is heard जस्तो स्टोमकमा त हाम्रो के छ पानी छ नि त सो पानीमा यदि एयर हाल्यो भने there is going to be bubbling sound. So if bubbling sound is heard it is going to prove that the tube has been inserted properly, it has reached into the stomach. Now after the tube has reached into the stomach, what do? We are going to wash the stomach now. Now what is the process of washing the stomach? So we are going to administer and aspirate 5 ml per kg of fluid, body weight of fluid, and repeat until clear fluid comes out as I've already shown you in the video. So we are going to aspirate 5 ml kg body weight of fluid and we'll repeat it as many times until a clear fluid comes out. Now after a clear fluid has come out and a clear fluid निस्किसकेपछि there might still be certain residues of the toxins of the poison that is remained in the stomach which may be very difficult to remove by this process. So त्यसको लागि जति little quantity minute quantity छ अब त्यो remove गर्नको लागि चाहिँ we are going to add activated charcoal है we are going to add activated charcoal into the stomach and this activated charcoal will absorb the little quantity of poison that may have been left that may have remained, right? So this is all the procedure, all the steps of gastric lavage. Now, what are the complications of gastric lavage? So, the complications of gastric lavage, one of the main complication is that there may be regurgitation and regurgitation यदि lungs मा गयो भने चाहिँ it can lead to aspiration pneumonia. So this aspiration pneumonia is one of the major complications of gastric lavage. Similarly, there can be chance of gastric perforation. सो जस्तो यदि हामीले होइन एउटा कुनै पनि ट्युबलाई स्टोमकमा राख्दैछौँ भने त्यो ट्युबले के गर्न सक्छ इट क्यान ड्यामेज द म्युकोसा अफ द स्टोमक द्याट क्यान लिड टु पर्फोरेसन है सो दिस इज अल्सो द थिङ अनदर इज इट मे बी wrongly inserted into the trachea so misplacement in trachea. These are all the things. There can be esophageal tears that is known as Mallory Weiss tear. So these are few of the complications of gastric lavage. So in which case should you not do gastric lavage? What are the contraindications of gastric lavage? There are two types of contraindications है contraindications दुईटा हुन्छ एउटा absolute contraindication एउटा relative contraindication absolute भनेको गर्नै हुँदैन यो केसमा so this is absolutely you should not do so you should never do gastric lavage in case of corrosive poisoning जस्तो एसिड अल्कालीहरूको पोइजनिङमा एक्सेप्ट कार्बोलिक एसिडमा चाहिँ गर्दा हुन्छ so uh, you should never do gastric lavage in case of corrosive poisoning except कार्बोलिक एसिड किन भन्दाखेरि कोरोसिभ पोइजनिङमा जस्तो एसिड यदि कोही मान्छेले इन्टेक गरेको छ भने एसिड इज अ कोरोसिभ है एसिडले के गर्छ टिस्यु डिस्ट्रक्सन गर्छ यसले अलरेडी स्टोमकलाई धेरै विक बनाइसकेको छ स्टोमकको म्युकोसा अलरेडी धेरै विक भइसकेको छ सो स्टोमक यदि धेरै विक भइसकेको छ भने चाहिँ यदि हामीले यहाँ ट्युब राख्यौँ भने इट क्यान लिड टु पर्फोरेसन सो इट क्यान लिड टु पर्फोरेसन स्टोमक टियर हुन सक्छ so that is why we should never do gastric lavage in case of corrosive poisoning. Why can you do this in carbolic acid? In carbolic acid poisoning, it will lead to leathery mucosa. Okay? Leathery mucosa, you will study this. Carbolic acid poisoning leads to leathery mucosa of the stomach. That is why there is no risk of that. This question may be asked, what is the contraindication? So absolute contraindication is corrosive poisoning except carbolic acid. What are the relative contraindications? Relative contraindications you can remember as CVP. So C stands for in comatose patient. You should not do this in comatose patient because comatose patient, if a patient is in coma, there is risk of aspiration, right? So you should not do this in comatose patient. In convalescents, example in strychnine poisoning, should avoid it. So from V you can remember in case of volatile poisons, avoid gastric lavage in volatile poisons. Volatile means like petroleum, kerosene poisoning, kerosene, hydrocarbon poisoning because in there is risk of aspiration pneumonia, right? Volatile gases it can lead to aspiration. Similarly, from P you can remember pregnancy. So you should never do this in case of this as well. Other you should never do this in hypothermia as well because in hypothermia there is whisking new spot in the stomach. That is why you should not do this in hypothermia as well. So you can remember the contraindications, right? So contraindications are you should never do this in corrosive poisoning. This is the absolute contraindication. Absolute. Others are relative contraindication. So convulsant, comatose, volatile poisons. It can lead to aspiration pneumonitis, esophageal varices, hypothermia. So this you should never do this gastric lavage in this case. This is not related to this chapter right now. So basically this is all about gastric lavage. Thank you very much.